Hey guys, it's Jeannette. Hope you're all doing well. I hope you really enjoyed the last video. That video should have helped you prepare researching the facility, looking back at your portfolio, recalling some patient interactions and events that you can use during your interview, some really good, helpful interview questions that you should have prepared, as well as how to look your very best so you can do your very best in your interview. Because I mentioned sometimes you will go to a job fair and interview for more than one unit, the way that they will contact you would be a little different than if you went to a hospital just to interview for one position. From my peers' experiences, those that interview in a job fair may not hear back for a couple of weeks. And for those that are applying to residency programs, may not hear for a couple of weeks neither, because there's so many candidates to review. Because I did not do a job fair interview or was looking to interview for a residency program, I just met with the director of the unit, a manager, and we just kind of had a 2-to-1, it was supposed to be 3-to-1 interview, and I heard back from HR within the week. So I interviewed Tuesday and I heard back Friday and had an offer letter in my email Friday afternoon. HR or whoever is going to call you will say, hey, the director of the so-and-so unit would like to offer you a position. And then they would recall if, your full-time days in the ICU, which was my position, and they will give you the rate. And at this point, you can either negotiate or take the rate, etc. So this is the opportunity that you can either accept right away, and then they'll send you either an email where you can click accept, or you may have to print, sign, and fax, email it back to them, or you can buy yourself a little bit of time. Some of my peers actually had multiple offers, so that second option of thank you so much, there's some things I need to talk to either my family about, or I need to think about some things, when can I give you a call back? And they normally will work for you. So one thing that I've learned, don't feel so pressured to say I accept right away. It would cause me anxiety, but that's exactly where I wanted to work. So I immediately said, yes, where do I sign? So yes, that's pretty much a good tip for those that would be attending multiple interviews and may have multiple offers. So now I'll let you know how to accept a job offer. They would schedule you for a processing appointment. And this is where you come in, you do a lot of paperwork, your W-9, you bring your bank info, copies of, or an actual voided check, so you can set up your payroll stuff, and you meet with one of the HR employees. And once all that's done, they may ask you to go get some lab work done, and this is where you have your drug, urine, and blood test, and that will probably take about 4 to 5 days to be sent and processed. So once all that comes out clear, then you would be scheduled for a employee health appointment. This looks different in many different facilities. For me, it was just a visit with one of the nurses in the employee's health office, and we kind of went through do I have any problems, moving, joints, can you lift this box appropriately? And they would just teach you just to make sure that you stay safe while you're working on the unit. We also did the TB mask testing, and it's pretty cool. It's like a mist, and they would, spray it in your face so you know what you would be tasting. And then they would put a mask and, make sure it's fit to you. And they would spray and do you taste anything? And they'll have you read something just to make sure that even with movement, that none of the particles would get in there. So we did that, and they gave me a little card to remind me what size mask I need to use in case I ever take care of a patient with TB. I know that some other facilities may have a more extensive physical test. So I think one of my friends was preparing for a really intense physical, which they could probably ask them to jog and do all this extra exercise. So that's a question that you can ask during your processing meeting, and just so you have a better idea of what to expect when you come back. So now that employee health appointment is complete, the next step, at least for me, was, hey, show up this date to start your actual orientation. And this wasn't on the unit orientation, it was just meeting with different departments of the hospital to get you to learn about, you know, the history of the hospital, what we're working towards, and learn all the policies and protocols that you should be doing as a new nurse. So I actually decided to use my Erin Condren notebook, which I am using for any orientation, notes, anything that will help me with documentation, and pretty much just kind of capture my experiences, especially in my first year of working as a nurse. So during orientation, I took notes, especially for protocols, you know, numbers, contact numbers, education, departments, anything like that would just be in one place, so it's easy for me to find. So in my facility, the RNs wear royal blue or white, and during orientation we were told that we just had to wear business attire or scrubs in any color. So I decided to do the scrubs just because, you know, I had a lot of scrubs that I bought from All Heart from the beginning of my nursing program, and I just wanted to stay comfortable because I didn't know what to expect. And for orientation, you're kind of sitting there for, I don't know, 8 hours a day or less. So during the orientation week, we had a lot of presenters that came in and, you know, gave a 15-20 minute presentation, depending on whatever it was. So we had people come and talk to us about H&R, where to access things, how to set up payroll, other benefits. Then you had more educational presenters that had to do, let's say, if you have a patient that could be a organ donor. A representative from LifeGift came and kind of explained, especially for those dealing with patients that, like in ICU or ER, what to know and what to look for and how to prepare for calling LifeGift, so they can be aware of there may be a patient that could be a potential organ donor, or there may be one that's already an organ donor. Other things like we had a educator stroke. So that's big throughout the hospital. They want to make sure that all their nurses know how to identify a stroke. We had other presenters talk about policies, anything kind of the hospital culture, any key acronyms, and how to be an employee of the hospital. We also were able to do kind of some skill checkoffs, like using the glucometer and PCA pumps and IV tubing, inserting IVs, etc. So it's just pretty much a mixture of making sure that as a new employee, and I just had to take a lot of notes because this is the first time I'm ever working in a hospital, and secondly, obviously, it's my first job as a nurse, I felt like I needed to make sure I knew exactly what I am required to do. So towards the end of my orientation week, we did a lot of computer work, learning the documentation system. That is pretty much one of my favorite parts of orientation week because, you know, during nursing school, you're just used to writing down paper, you know, care plans and stuff like that. And working in the hospital, one of the biggest challenges you have to get through is learning how to utilize their documentation. So that was pretty fun. And you had like a computer class, and you had a fake, you know, patient armband, and the instructor would tell you how to navigate through all of the tabs, know where to do your admission, assessments, anything that had to do with just taking care of a patient, medications, how to utilize the references tabs. That was all really helpful. So I'm glad I got to play with the computer and their documentation system before I got on the unit, because I would have been really lost once I got to the unit. Overall, orientation week was pretty fun. The first day of orientation, they had our badges and had my name and RN, and that was just such a moment. I almost, I think, cried. Throughout the week, you get to meet other individuals that may be working in your unit, so you kind of already start meeting people, which was great. So for me, I'm working in the ICU, and one of my peers is in the IMCU. So a lot of our classes and extra meetings were done together. So we get to, you know, get to know each other, eat lunch, go to these meetings, which is really nice because especially you're starting something new, a new environment, new job, new employer, and getting to know people will be important just so you have some people to talk to and get to know and just feel more comfortable. Overall, I had a really good time. My orientation like that was only a week, and the second week was actually meeting my preceptor and working on the unit 3 12-hour shifts. So I hope you enjoyed this video. Hopefully it gives you an idea of what to expect during orientation. There will be a lot of video demonstrations, a lot of hands-on, a lot of computer time, and overall you will be given a schedule and you will just follow that. So that was pretty much a full work week for me, and we were paid for the orientation week. I was really excited to meet people, and FYI, there's one of you guys that I work with. So it was really exciting to get to meet that person. It's super awesome. I had a great week, and I was just really excited to get to the unit because I was ready to take care of some patients. So the next video is going to talk about orientation, preceptor, and working on the unit for the first week as a new nurse. Don't forget to comment, like, and subscribe, and share the videos. Bye.